What is the biggest problem? You have great agencies and they're all working in parallel. They're not a system. There's no such thing as a homeless system in most cities. There's homeless agencies doing good work but not converging on the problem. So I forced them into a system. Everybody had their own intake platform. We forced them into, we have one intake platform. Everybody has to be on it so I can find somebody through the system, because they would come to one housing agency and get treatment. This one is the job search help. This one is dealing with health care. And they weren't talking to each other. So we forced them into one system. And I also, when we initially, we did because of our work with the veterans, I knew what particular services each one did, but we did a heads in bed survey, and we had about 10,000 homeless on the streets of Houston when I started. We had hundreds of beds every night that were vacant, but every agency had their own criteria of who they wanted to serve. And there was a complete mismatch with who was actually on the street as to what the beds were. So then it's like, I knew the landscape, I knew who the players were, I knew who would work with me, who wouldn't. And then I got my baseball bat out, essentially, and said, I am moving your money. We're going to fund the agencies that are best at these particular services. And if you can find other money, that's great. But anything that's got a federal dollar attached to it, I'm going to put it where we can maximize services. And then the third big thing was that we started building housing as rapidly as we could.